Hello everyone, my name is Ana Clara and today I will talk about bioactive materials. First, I would like to thank Dr. Deifala for this opportunity. It's a pleasure for me to share a little bit about these materials with you, doctors. I'm a pediatric dentistry from Brazil, and I went to Japan as a visitor researcher for 1 year to study more about dental materials. Nowadays, I'm a professor of pediatric dentistry, caryology, and dental materials. And today, I will explain a little bit about bioactivity with a focus in SPRG technology. But before talking about SPRG fillers, SPRG technology, we need to understand the concept that was considered to develop this technology. Therefore, we need to know the definition of bioactivity. The concept comes from medicine, and for the Dental Materials Academy, the definition is the ability of the materials to release ions, which plays a potential role in biomineralization. The best known materials with those characteristics are glass ionomer cement and calcium silicates as MTA. However, I think a generic definition could be more appropriated, considering bioactivity as an ability to mimic an action or effect of the organism. So, bioactivity is present at all stages, both in health and in development of caries disease. And today we will focus on bioactivity restorative materials which can act to prevent new lesions around the restorations and also promote remineralization of the dentin remaining. So, in addition to innovations to improve clinical practice, great focus has been placed on bioactive materials to provide composite resin restorative materials, the ability to inhibit bacterial attachment or growth on their surface. It's beneficial to incorporate antimicrobial agents such as SPRG fillers. And within the philosophy of minimal interventional, it's desirable that the restorative material has antimicrobial properties in addition to promoting remineralization of dental tissue, since it's a challenge to motivate our patient to perform oral hygiene effectively. So we need the patients cooperate, not only a good material or a good technique. Let's start bioactivity with a glass ionomer cement. So, glass ionomer cement is a great bioactive material due to its biocompatibility, chemical adhesion to tooth structure, fluoride release, and linear thermal expansion similar to the tooth. However, its mechanical resistance is not good, also the aesthetics. Regarding the durability of the restorations, the study with the longest investigation reported in the literature demonstrated that it remains effective even after a period of 10 years. So let's observe the chemistry of glass ionomer cement. I know that dentists as well as clinical researchers don't really like chemistry, but chemistry can help us to understand the material and that has an impact on how we will use this material. So I'm going to share something about chemistry with you, which is the basis for the development of SPRG fillers. So here we have the composition of glass ionomer cement, the liquid composed by water, polyacrylic acid, hydrogen ions and carboxylic radicals. And the powder with glass particles and ions as fluoride, calcium, and aluminum. When the powder is mixed with the liquid, a series of acid-base chemical reaction starts. First, the hydrogen ions will be released and will attack the glass particles, which will release aluminium, calcium, and fluoride only from the surface of this glass. And the chemical reaction will take place between the carboxylic radicals and calcium and aluminum. And that's what we call polysalt gel, which is the matrix of glass ionomer cement. This matrix is responsible for some of the weak mechanical properties of these materials, but on the other hand, this structure is porous and small ions are free to move through the material. Therefore, after the manipulation, the glass ionomer cement restoration has more fluoride than the oral cavity, so this ion will be released. So we can check here, fluoride free in the matrix of GIC, then it will be released to the oral cavity. Over time, of course, the amount of fluoride will be decreased but when the individual brush their teeth with fluoride paste, when they drink fluoridated water, undergo professional fluoride application, the amount of fluoride in the oral cavity will increase. And so this fluoride will move to the glass ionomer cement, recharging this material with fluoride. And then this ion will be released again to the oral cavity when it's necessary. Another important question we need to consider is, every type and brand of GIC behave in a similar way? Unfortunately not. When we think about the type of glass ionomer cement, the evidence shows that the best restoration survival rates are achieved with resin-modified GIC and high viscosity glass ionomer cement. And an important point is that the brand also has an impact of glass ionomer performance. Here we have some evidence, and it's always important to analyze cost effectiveness when we choose a glass ionomer cement. It's important to consider those information before decide which GIC we will use, which one is better to use in the clinical practice. Glass ionomer cements are good material to restore cavities in deciduous teeth, and it's been indicated to restore teeth affected by molar incised hypomineralization, with good results in the literature showing survival rate around almost 90% after 2 years, 78% after 12 months, and 98.3% after 12 months. Those results are very good consider the challenge of molar incisor hypomineralization adhesion. And so, this good performance must be due to the type of adhesion between glass ionomer cement and hypomineralized enamel. Here, the carboxylic radicals will react with the exposed calcium of the tooth, resulting in chemical adhesion. Probably, this type of adhesion is less affected by hypomineralization when compared to the adhesion of composites. And for all those reasons, I'm a big fan of GIC, but it doesn't make me blind regarding the limitations of this material, especially regarding some mechanical properties such as material wear in addition to its aesthetics, which is definitely not good compared to composite resins. So, considering those limitations, research and industry are searching to develop materials with the ability to have the bioactivity of glass ionomer cements and the aesthetics of composite resin. And there are several new biomaterials, and this is a very good review for anyone who wants to know more about them. But today I will focus on the SPRG technology, which for me is number one when it comes to bioactivity, aesthetics, and good mechanical resistance. SPRG fillers, these particles are incorporated into different materials characterizing Giomer technology. All material from Giomer family has as its main characteristics to release six types of ions: borate, aluminum, fluoride, strontium, silicate, and sodium, each one with its bioactivity property. So this is the SPRG fillers, which means surface pre-reactive glass ionomer. The first important information is about the development of an exclusive glass that contains fluoroborosilicate by Shofu Company. This is a very reactive glass, and this is a multifunctional glass which is used to develop the SPRG filler. So let's understand how does it works. The pre-reactive glass ionomer surface corresponds to the final process in which this multifunctional glass developed by Shofu reaches a suitable size. So this is the first step to develop the SPRG fillers. After the glass reaches a suitable size, it is applied another layer to this glass to protect this glass. So we have a surface modified layer. This modified layer is porous, and when polyacrylic acid solution is applied over it, let's take a look closer in what it happens. So here we have the modified layer, which is porous. And when the polyacrylic acid is applied over this modified layer, the hydrogen ions will attack the multifunctional glass, releasing six types of ions and starting an acid-base reaction that results in the matrix. Furthermore, sodium ion will attract the other five ions, forming a complex of six ions. So, this is the glass ionomer layer, and let's take a look at the entire particle surface to understand it better. Here we have the glass ionomer layer, the yellow one, with approximately 50 nanometers. The modified surface layer, this one which is porous, has around 200 nanometers. And in association with the glass core, the entire particle is around 3 micrometers. So the SPRG filler is 60 times bigger than the glass ionomer layer. This layer is very, very thin, so that's the reason why the mechanical properties of the material are not compromised when we use this particle in the materials, because this layer is very, very, very thin. And this one is the responsible for the bioactivity of the materials. When this particle is found in the oral cavity, when in contact with water or acid from the oral environment, the water will attack the sodium and the sodium will attract and release the other five ions. So first, the sodium comes and it will attract the other five ions. So these six ions will be released to the oral cavity. And what's the function of each ion? So each ion will play an important role in the bioactivity of the material. Let's take a look in what each ion will do. So strontium will work in neutralization and resistance against acids, and also will work in remineralization. The fluoride will work in the decrease of demineralization and increase of remineralization. Silica will work in remineralization and on structure reinforcement. Aluminum will work on sensibility control. And boron will have an antibacterial action, preventing the bacterial adherence. And as we saw, sodium will activate and optimize the function of these other five ions and also attract those five ions to the oral cavity. This is Mr. Nakatsuka-san, known as Mr. Giomer. He's the responsible to develop all this technology of SPRG fillers. And all I learned about those fillers, I learned with him. Okay, now I explain a little bit about SPRG technology, and you must be wondering, SPRG fillers, glass ionomer cement, giomer, what's the difference among those materials? So, all the products that contains SPRG fillers are called giomer. So, SPRG filler is not the final product. And giomer is not a type of glass ionomer cement. The bioactivity of glass ionomer cement itself inspired the creation of SPRG fillers. And the SPRG fillers are present in the composition of several products, and we'll talk about some of them at the end of this presentation. So, the SPRG filler will be a part of the composite resin and can be in different size according to the need of each material. So it can be around 3 micrometers, 1 micrometer, less than 1 micrometers. And one important information is that silica is also added because the exclusive use of SPRG fillers would make the material very, very expensive. So the materials have SPRG fillers and silica in its composition. Let's take a look at the characters of composite resins. There are many studies showing that the mechanical properties of composites with SPRG fillers are similar to conventional resins. Furthermore, it has been reported that they are capable of inhibiting the growth and metabolism of Streptococcus mutans on its surface due to its release of multifunctional ions. It's important to highlight that the composite resin is the material that aggregates more bacteria on its surface. So here we have uh, the Gyome restorative material, and we can check less plaque adhesion. And this one, traditional nano hybrid composite resin without SPRG fillers, so we can check much more biofilm on it. So we can see that SPRG fillers can inhibit the bacterial adhesion. Here is a study of mine in which I compared two composite resins, Beautiful Book from Shofu and Filtech Book Fill from 3M company. After 24 hours in a biofilm reactor, we could check less adherence of biofilm for the bioactive composite resin from Shofu. Also, we checked later by SSOCT device, and we observed loss of enamel for the group restored with Filtech book fill and no loss for the Beautiful group. So we could check here the difference between a bioactive material and one which is not bioactive. And we confirm those results using CLSM device. So loss of enamel only for Filtech book fill group. And moreover, we observed a bright zone for the Beautiful group near the composite restoration. So we checked using EDS device the presence of phosphate and calcium, which means remineralization in this area. So we conclude that the bioactive composite resin can prevent demineralization near the restoration and also can promote remineralization of the remaining dental structure. One more important thing to consider is that bioactivity is interesting and very, very important, but we have to be always careful and respect minimal intervention dentistry. So we will perform a restoration, obviously, only when it's really needed, because there is no better material than the tooth itself. Why remove it without need? So we need to stop looking only for the teeth. The first step to a successful treatment is to focus on the patient and not only on the restorations and disease. We need to start seeing and treating our patient, giving orientations about oral hygiene, diet, and keep monitoring this patient. So, SPRG technology can help us because these materials are used not only to restore injured lesions but also to prevent tooth decay. So let's check some materials with this SPRG technology. First one is a flowable composite resin, which is nanohybrid and must be added in 2 millimeters layers. And what's the difference between this one? This one has 70% of charge, so it has high mechanical resistance, so it can be used from the beginning until the end of the restoration, of course, respecting the layers of 2 millimeters each one. So this optimizes the clinical time, and this is very important, especially dealing with pediatric dentistry patients. So the indications are for class 1, 2, 3, 4, 5 restorations. For injectable resin technique, which uses a transparent silicone wall, and for caries lesion sealing also. The incisor collar is being very used to make attachments for invisible aligners. And there is also a conventional version, a regular one, for this nanohybrid composite resin, which has the following indications for class 1 to 5 restorations, core reconstruction, direct facet, and repair of fractured incisal edges. There is the version of Beauty Fill Opaquer, which is very good to work with dark substrates to help with aesthetics. And also a version of Book Fill ones, which can be inserted in one only increment. And this is the flowable one. And there is also the conventional one, Book Fill Restorative Composite Resin. There is one which is the Beautiful 2LS. This is also nanohybrid with low shrinkage. LS means low shrinkage, with the lowest polymerization shrinkage of the composites resins of dental market. This one must be used in increments of 2 millimeters. There is also the injectable one, which is nanoparticulate, so it's very good because this has a very high mechanical resistance and very good polish, so very good for aesthetics also. This one is indicated for anterior teeth, deciduous or permanent, classes 3, 4, and 5, minimally invasive aesthetic restorations, diastema closures, direct resin facets, cervical layer in contact with the gingival margin, creation of the palatal shell, and injection of resin using the silicone wall technique. Regarding adhesion, there is FL Bond 2, which is an auto-conditioning adhesive, and Beauty Bond Universal, which is auto-conditional and universal one. This one can be placed in a very thin layer around 5 micrometers, which is perfect for aesthetic restorations. Another important material which contains SPRG fillers is the PRG barrier coat, which is a light curing resin coat and allows application in thin layers, so it will work in acid neutralization, having anti-plaque effect. And it's important to highlight that the blocking protection of this material works for 6 months. So every 6 months we need to apply again this material. The indications of these materials is for dentin hypersensitivity, areas that are difficult to brush for orthodontic patients, patients with high risk of dental caries lesions, and for white spot lesions. So it will work preventing demineralization and promoting remineralization. All the benefits that we checked about SPRG fillers. And to finish, I would like to show the only self-etching resin sealant of the dental market, which allows a chemical adhesion between the monomer and the calcium in the tooth without the need of acid conditioning. So it's very important, especially for deciduous teeth that have less minerals than permanent teeth. And to finish, I would like to thank you for your attention, doctors. Here is my contact. I'm available to discuss about any doubt. It was a pleasure to share this technology with you. So, thank you very much. Obrigada.